Good day, friends of Buzzy. So today I'm back in my office, which means that I am not wearing a mask. Given that last time I did this, I had to sneeze vividly on camera, I decided that I would go and do it back here today. The other reason is because this is Wednesday, so we have a visit from the good Dr. Keith Cronin. Hello, Dr. Keith, you're live and live and on my phone. And so we're going to talk today about other kinds of pain and the issues with not really knowing when you can go back and a sudden rash of back pain. So I'm going to start today with a little shout out to our aromatherapy partner. This is this one is for sleep. And one of the reasons I'm talking about our aromatherapy partner is because 2 papers came out in the last week talking about the symptoms of coronavirus. And what they found was that loss of sense of smell, muscle aches, fatigue, and depending on which study it was, one was fever and one was loss of appetite, but those were 80% predictive by themselves. And so the overwhelming number one symptom that was most predictive was loss of smell. So in addition to being able to have a nice aromatherapy, this may be partially able to help you determine if you have a sense of smell, because if it smells good, your nose is still working. All right, second thing in terms of getting to business before we talk about general pain is that we still have our Nurses Week special on. So we talked on Monday about how Buzzy and Ladybuzz could be used for vaccine pain, and we also have a special for nurses, which is 20% off of our healthcare units. So that was supposed to end with Nurses Week, but we've decided to continue that until the end of this week. Along those lines, as you know, if you've been following, right now we have packages for pain management. So the opioid crisis is part of what started us on leaving just being a pain relief device for needles and moving into general pain relief. One of my colleagues had a knee replacement that he had put off for about a year because he'd had a previous addiction to opioids, and he didn't want to do any knee replacement if it was going to mean that he had to get on opioids again. Because he was able to use the larger Buzzy unit, like so, and have this be the pain relief instead of opioids, he was able to get his knee replacement, and when he had to get his next one replaced, he didn't need to wait as long. The recovery was much easier. So this whole opioid pathway is where we started. And when we began realizing that coronavirus was a huge public health issue, not just from the virus, but for people who stayed at home, we wanted to make something available for home pain management. Over the past 2 months, wow, it's already been 2 months. Over the past 2 months, we have put together additional accoutrements with our VibraCool package. So the first thing is, because there is no one answer to pain, there is no silver bullet, we have the What Works for Pain, which includes not just things like a surgery or a medication for cure if it's arthritis, but supplements and physical interventions and mind-body interventions. Anytime you have a pain problem, you need to have a multi-focused approach, and you also need to have something from every category so that you can always keep changing things up and working with it. Now, we have had our VibraCools on sale, and we're including multiple free samples and coupons from our pain care partners. We are going to take that discount off as of the end of this week. So you physical therapists and people who have patients, come to us for a discount coupon that you can still give your patients, but overall and in general, we're going to take off the discounts on Sunday. So Nurses Week, Healthcare Buzzies, 20% discount till Sunday, VibraCools, 30% discount till Sunday, but there will still be options. The reason that we're going to start getting back into talking more about pain management is that over the course of the history of the United States, we have had two different big events that have dropped our life expectancy on average by a third of a year. The first one was the HIV crisis, and between 1980 and 1981, the life expectancy overall for the whole United States went down a third of a year because of the tremendous death rate of HIV. The next time this happened was 2015 to 2017, and each of those years, because of the opioid crisis, again, Americans lost an average of a third of a year of life expectancy overall because of the effect of the opioid crisis and opioid overdoses. The current hypothesis and the current calculations for coronavirus are that probably over the next 2 years, again, the severity of this crisis will lose another third of a year, 0.3 years of life expectancy because of the coronavirus. The scary thing is that we were starting to make progress against the opioid overdose issue. And in the most recent statistics we have from the last 2 months, overdoses have increased by 300% and suicides have gone up, and that's particularly in patients with chronic pain. So I want to get back to our roots a little and try to help people with chronic pain have hope that there are solutions even if you're stuck at home. So to that end, I have invited the good Dr. Keith Cronin. And Keith, thank you for coming with us. And I'm going to switch the phone around and ask you a few questions. And I'd like to particularly ask you, there we are, about what kind of pain problems are you hearing about in relation to the coronavirus? Where has there been a particular issue?
So a particular issue is chronic low back pain. And this is just a situation where I'm the physical therapist talking about. I live with it myself. And one of the big deals that we have, we're stuck at home, we become inactive, we lose our routines, stress, being depressed, all these types of things. It can start to flare up the low back, and then that causes oftentimes pain down the legs, particularly if you have a disc issue.
So why would stress in particular hit the low back? Because I'm not sure that
any injury associated, particularly with the spine, is a bit more reactive to how our emotional and stress levels are. So if you have knee pain, ankle pain, generally those things, shoulder, those are relatively predictable. But when it comes to your back, just things like being inactive for a bit of time, feeling the stress of daily life, it can cause those deep intrinsic muscles to either tighten or weaken or not work appropriately. And because of that, you start getting chronic pain that starts as a 1 or 2 out of 10, and all of a sudden it's a 10 out of 10 by the time it's all said and done, and you're like, but I didn't do anything. And part of that is because you didn't do anything. And so it's a bit of a catch-22 where you sit there and go, well, I don't want to do too much to hurt myself. If I don't do enough, then I'm going to get worse.
Well, what do you have to suggest if you are stuck at home and your back pain's getting worse?
Absolutely. So oftentimes if your back does hurt, one of the things you're afraid of doing is then moving. And inevitably, we need motion to be able to heal ourselves. And it's very particular to the back because those discs in the middle, if you don't move around, they don't get very good blood flow. So you have to move. But with that, we also know it hurts. So using that, we can use a VibraCool in conjunction with some of the exercise prior to even starting and putting it directly over the spot that hurts. So for me, personally, I always get it on the lower left side of my back. And so I could take this just before I even start, put it directly on the spot, tie it off here, and then go right into exercise. Now, a lot of different products out there, you have to use them separately, but the great part about VibraCool is you don't. You can just use it at the same time. So you can see right here, I already have it on and working, and then you can ask, like, well, what would you go into doing? Well, just think of your basic spinal stabilization exercise. You can easily do your bridging exercises while you're getting the benefits of the high frequency vibration. You can easily flip into something like doing plank, no problem, right? You can do your side plank. The whole time, you're getting the benefit of that high frequency vibration right on the spot that generally causes you the most issue.
Now, if I may ask, how long do you hold your planks? Is there a time that you should be striving for?
Yeah, ideally you want to be able to start small where you're holding it maybe only 5-10 seconds. But inevitably, if you can get up to 30 seconds plus while maintaining belly button in, drawing it to actually activate the deep intrinsic muscles of the back, then you have something that's you're going to get long-term benefit from. Particularly when we have chronic low back pain, those are the muscles that tend to shut off. And because they shut off, we don't get that spinal stabilization that we need on a daily basis. And the great part is you only need a little bit of activity each day to be able to keep those muscles working.
Got it.
And so going into those different exercises, you can then easily, and last one, you can flip over. One of the biggest challenges is just doing things just like doing any of your Superman exercises, your spinal stabilization. The great part about this is it stays in place the whole time. So it doesn't matter which way you move, the VibraCool stays in place. But then once you're done, I've had lots of people comment to me, it's like, well, that's great, but I hurt later, and I don't want to have this thing on all day, but I do have a back brace. I'm like, great. Well, you have something already in place to keep it in place. So this is my back brace, because again, I'm not just the president, I'm also a client. Okay? And because of this thing does not leave my house, because every once in a while I go pick up a kid or I do too much outside, and then wham, spasms right up. So what I've learned to do is, if I get that catch, and anyone who has chronic back pain knows what that is, where you start to feel it slowly seize up. Uh-oh, here it comes. So what I do is I get my back brace on, okay? And then what I can do is I can grab just the piece of the VibraCool as well as a cold pack, and I can just slide this right into the back brace. So that spot I was talking about, put it right in there, click the button, put it back here, and here's the great part. Most of these back braces come with things to tighten up with. And now it's sitting exactly where I need it, and when I get up and get moving, it's there the whole time. The brace is designed to provide the stability you need to address those muscles that are overworked, overtired, or not functioning properly. But there's actually nothing that does anything for the pain. This does it for the pain. And oftentimes that pain can cause this to exasperate more. So you put the two together, and when you have people who are commonly inactive right now, who are struggling with stress and potentially depression, this is something that can get them up and going and walking and making sure they're keeping themselves healthy as possible. Again, to address the fact that, yes, this could affect the life expectancy of people out there. But there's always tomorrow, but this is something that can be done today.
Wow, that's something that can give a little hope. I love that idea. When you have used the vibration part on the spot, when you start to feel it seize up, what have you experienced? Because we haven't studied that. We do have I'm going to turn it to me now. We do have an NIH grant that is looking at developing a multi-frequency vibration unit for reducing opioid use for chronic low back pain patients. But I am not that much of a low back pain person myself. So what have you experienced in terms of how long have you left it on there optimally? Does it change from when you start to feel the spasms to does it abort the spasms, or does it mitigate them? What has been your experience? And mind you, this is one person's experience, but as we're studying the low back, I'd love to know what kind of questions I should be asking our patients.
So even as a person of one, I don't have the back pain that, I randomly, happens once a year. I have the one that's the chronic. I have something built in that's a problem. So I'm very familiar what works and what doesn't. What I found with this is, if I start to feel it tighten up, I put the back brace on, and then what I do is I put this on for up to about 10 minutes, and what I found is at that point, it brings the pain down. It doesn't eliminate it completely, but what it certainly does, it makes it very manageable. And now I'm less stressed, I'm less tense, and so this is providing the support, this is calming down the pain, and that starts to let the muscles relax. And by doing that, the pain then stays here, and I found when I do this, I'm not getting it down my legs. Because when it goes down your legs, it means that you're having increased compression, you're having increased irritation. Beyond that of just here, it's actually affecting nerves. And if I can just keep it to my back, I know within a day or two I'm going to be fine. If I get it to the point where I'm feeling it down my feet, it could be a week or two before it resolves.
Wow.
So if I get to it fast, it helps.
How many times a day will you use the vibration part? And have you ever done it with heat, or is it usually cold, or is it just the vibration alone?
Yeah, so if throughout the day, if I'm active, I just use the vibration alone. If I'm getting started with something, I'll sometimes do a heat pack or warm up and do some stretching beforehand, and that seems to help. But when it is acute and it flares up, and I know I just did it, I'm very aware of when it happens, I go right to it immediately, get that cold pack, get the VibraCool on top of it, get the back brace, and I've found I've really mitigated some problems in the past year using this that I've had in the past. I've had it before where I've been down and out for a month, and if I find I get to it fast and I calm myself down and I don't let it get worse, it shortens the time tremendously before I'm back to normal.
Cool. And last question, how many minutes or hours of relief will you get, or how many times a day will you find yourself using the vibration if you're in a back pain cycle?
If I'm in a cycle, I'll probably use it 3 times a day. It's probably about on average. And I found I usually get a couple hours. I've gotten a little bit more once you start feeling a bit better. You get a little bit more time. Acutely, though, maybe a couple hours, 2-3 hours that I found is beneficial. And usually by that point, the day started to wear on. I've sat down. I've stopped, bending over to do stuff like empty the dishwasher or pick up kids. And, you got to use your brain a little bit. And then I find that if I do that right at the beginning for the first day or two, then it's just intermittent as I need it. And but if anything flares up, I know I can go to this and this together, and it's just way, way more effective than anything I've ever had in the past. And I've had many years to have things that not work. I found that this works really great for me.
Wow. Well, thank you. Thank you very much. I loved your Superman, and I'm also really glad to know that, I'm going to turn it back to me. So I have been trying to be Michelle Obama and do 3 minutes of planking, and my record ever is 1.5 minutes. And so to know that I could only do 15 seconds of planking and still feel like a stud, that's worth the price of admission for me right there. Yeah, I can go away feeling good.
To your point,
so
you're on your way.
Well, thank you so much, and are there particular braces that you know of that it works better with? Do you know any of the different types of bracing where you've got the best fits?
So for the best fit is one that's going to be similar to this one that is going to have that sort of thin profile to it. So and that's the reason, because it lets the product slide in easily. And then it's going to have those little tags on the side that let you pull and tighten it up. Because what you'll do is you'll slide it into position and get it here. And then what you'll do is you'll tighten it up so it doesn't move. And I found, and you can get these just off the shelf back braces, and this is going to take what you've been doing with this to whole new levels, because you're going to get both the support and the pain relief at the same time. And that, to anyone who has chronic back pain who sees this, you know exactly what I'm talking about.
Wow, that is fantastic. Well, thank you so much for joining us. And if you have chronic pain, don't neglect taking magnesium as a supplement as well, and not just soaking in a bath with it. You've actually got to have it in your body to reduce some of the spasm and the inflammatory components. All right, well, to reiterate, we have talked about the Nurses Week 2020 discount that's on our buzzyhelps.com site, and that's going to continue until the 15th, 16th, but until this Sunday. We also have the VibraCool discount that will continue 30% off until this Sunday. And if you have any issues, or if you are a nurse who does anything with needle phobia or with vascular access, I am having a fear and fainting needle fear friendly webinar tomorrow with the Association of Vascular Access, and we will post a link. So it is a free CE event. There are about 800 people registered now. I don't know if they have a limit of 1,000 in the room, but there will be CE offered. And by all means, we'll be continuing this 3 times a week until the end of May, or the crisis is gone. So like us, subscribe, stay tuned, and especially with the kind of advice we've gotten from Dr. Keith Cronin, it's going to be fine.